what I'm going to talk about today is really about the way we need to build policy, infrastructure, and community in order to really engage patients. And I want to do this by virtue of telling some stories. I'm going to tell 3 patient stories. I've been working on a new book about patient engagement from the standpoint of the patients and caregivers. So I'm going to use those patient stories to really talk about what some of the policy and community implications are. So I'm going to start with a story about Kelly. Kelly is 40. He's a freelance photographer. He's been on his own for quite a while, so he's actually carried his own insurance since about 1995. Right now, he is in an exchange policy, but it's got a really high deductible. He's got a $6,500 deductible. So when Kelly gets health care, he's a cost-conscious shopper, and he's a cost-conscious shopper because he's got to be. It comes directly out of his pocketbook for the most part. So this is first a story about how Kelly needed an ultrasound. He went to his provider. Guy said, I think you need an ultrasound, actually for a nodule on his testicle. And go down to the front desk, they'll get it scheduled. Kelly said, what will it cost? I don't know, they'll tell you at the front desk. Front desk didn't know, told him to call billing office. Billing office told him he needed a code. Gets the code. It's going to cost $800. Well, this is a lot of money to Kelly. So he goes back to his provider via email and says, is there anything else I can do? It's going to cost me $800. So his provider said, well, I don't know, I'll send you to a urologist. But when he called the urologist, they said, oh, we're going to need an ultrasound. So then he decided he would go to his insurance site and see if they had a cost estimator to see whether he would get any discounts. Sure enough, they had a cost estimator, but his procedure wasn't on it. So it really didn't help him much. Then he went to provider directory and started looking at other providers in his area. He lived in Madison, Wisconsin, where he could perhaps get a price from somebody else. Called 6 different providers, actually did find an ultrasound for half the price, happened actually to be at a hospital that his doctor practiced at, so he could get the ultrasound. Goes in for the procedure and indeed has the ultrasound. All is good. It's going to cost him $400 until, of course, he gets the bill. And then guess what? It's $400, yes, but there's also a charge for an additional $125. What's this? He has to make a call. And they tell him, well, as long as we were doing the ultrasound, we did another scan because, you know, it's just to make sure nothing else is going on down there. He's like, I'm lucid. I was there. I was awake. Why didn't you ask me? I didn't authorize this. And they say, oh, we never ask the patients, but don't worry, your insurance is going to cover it. No, not my insurance. I'm essentially self-insured until $6,500. So he had to make 2 more phone calls to get that charge removed. All in all, it took, I believe, 15 phone calls, 2 emails to his doctor, several web searches to actually get a price. Now, really, how many people are going to do this? You can tell Kelly got the bit between his teeth at some point. He was like, I'm going to get this. I'm going to get this price and I'm going to get it lower. But most people don't have the time or the energy to do that. So what are some of the things we can learn from this about policy implications? Certainly one of them is that if we really want people to be cost-conscious consumers, we've got to make it as easy for them to compare costs in healthcare as it is to compare the cost of buying an iPhone or a mattress. But the other thing is we've got to stop using excuses to not be transparent about the price data. One of the things that bothered the heck out of him is when he asked, well, so is my insurance going to have a different price than the one you're telling him? They said, oh, yes, absolutely. We've got negotiated rates. He said, so what would that be with my insurance? Oh, we can't tell you that. It's confidential. Well, it's not confidential when he gets it on his bill. So why is it confidential when he calls on the phone? Again, we've got to think about this differently. And one of the things that we've got the opportunity to think about when we're dealing with price information is that, of course, healthcare isn't just about cost. There's a whole quality dimension. And we haven't given consumers a clear way of thinking about what that dimension is. In every other aspect of their lives, they look at cost as a proxy for quality, right? Hotels, purses, you name it. We can usually think that the amount we're going to pay for something is a reflection of its quality. So in healthcare, that's not necessarily true, but we haven't helped people think about what that is. We need to engage in a whole new conversation about value in healthcare that both helps people understand transparently the costs, but also the quality of what they're getting. Another story. This is Whitney. Whitney is 33. She's a new mother. She's got a newborn and a 2-year-old. She lives in a major metropolitan area, Washington, D.C. And Whitney's a tech-savvy person. When she got married, she used the knot to help manage her marriage process. When she looked for a house with her husband, they used the Nest. When she got pregnant, they used the Bump. She uses a Fitbit to track her steps and exercise. And now with her baby, she's using a Total Baby app. But guess what? Even though she's clearly very engaged around her health and very tech savvy, and even though she lives in a major metropolitan area, she doesn't actually have access to either her data or her children's data online. She doesn't have the convenience of using a web or app feature to make an appointment. She can't refill prescriptions online, and she doesn't have access to her medical records or email with her doctor. So in a situation like this, Whitney is operating in a system that is neither as convenient nor as connected as she expects and deserves. So the lessons we can learn from thinking about this situation is that if we're going to keep up with the connected consumers like Whitney, we have to be both more digital and more convenient than we currently are, certainly. And we've got to actually think about keeping up with the people in the consumer products space, in the hotels, in travel, in the other aspects of their lives that they have been used to these kinds of service, because they translate those expectations into their healthcare experience. We've got to think about how we use technology to connect people and their data together to provide a clear health history that incorporates that self-generated data. And we've got to think about connected communities that are both virtual and in person to help meet the needs of everybody and help them build those personal connections that are a part of being well and staying well. Third story is about Don. Don's 68. He is a person with multiple chronic conditions. He has diabetes, which was diagnosed in 1999. He has heart disease. It started with AFib, so he got an implanted defibrillator in 2008 and open heart surgery this last year. He is depressed. And as he says, I've been fat all my life. This is just how I am and who I am. He is now covered by Medicare and Medicaid. But when he had the implanted defibrillator, which cost him $100,000, he didn't have insurance. So he's paying that off, $100 a month. And Don hit rock bottom in 2008. He had depression from his brother dying in 2003, had gone undiagnosed for 5 years. He lost his job. He lost his house. He was living in his car. His diabetes was completely out of control. And he was able to reach out and get care from a nonprofit. And actually from a clinician who had a sliding fee scale. And the clinician started helping him at least get in touch with his depression and some of the causes of it. But he was still in this vicious cycle. When you are depressed, when you are sick, It's very hard, and not feeling connected to your community, it's very hard to take action to change your healthcare situation. But his doctor, his therapist, put him in connection with a group called the Community Clubhouse. I don't know if any of you know about it. It's an international nonprofit. And it's particularly for helping people with mental illness, and in a very self-generating way, so that the patients and the community members actually run the institution. They helped him understand his condition. They helped him get disability started, helped him find a job, helped him find housing, and they helped him believe in himself. They became his family. And as a result of that, spurred perhaps by the fact that just as his life seemed to be coming together last year, he found himself needing another open heart surgery because he had several blockages. He took stock of his life. And after his surgery, he was put on a strict diet. He's also in the early stages of congestive heart failure. And he started going to a water exercise class. He lost 65 pounds. He lost his cane. He lost his warfarin. And he's got a new lease on life. This is Don. Before, on the right, and after, on the left. He was able to go to his 40th class reunion, a completely new person, somebody that people who had known him from childhood didn't even fathom that this was the same Don that they'd known and loved. So what can we learn from this situation? I think one of them is that you never know. We still do not know what it is that makes any given individual choose a moment to change his or her life. Don's the kind of person that it would have been easy to give up on. We do this all the time in healthcare because somebody hasn't responded to all of our entreaties to change. They are complex. Lots of things are interconnected, and it feels hopeless to do it. But Don's a great example of how we need to meet people when and how they are. We have to figure out ways of getting them connected to a community that's greater than the healthcare community, that will give them some of that support that we don't necessarily have the time, the space, the energy to do. And as we do that, we never know sort of what will be the cue that makes somebody choose to take that moment to change their lives. So as I think about the lessons that I've learned from these folks that I've chosen to highlight here, and also from a variety of other patients and caregivers that I have been interviewing, I think there are a couple of key lessons. One, we've heard this whole thing about we've got to have an infrastructure that actually works for people, where when we create things like high deductible policies, we actually think about what the tools people will need in order to manage those are. We've got to make it easy to incorporate patient-entered data with clinical data to look at trends that cover both so that people can get a full picture of their health. We, I think, here in this room, in this conference, know more than anybody else that we've got to figure out how to innovate at the pace of the connected consumers out there. But this is not something that everybody in medicine understands. And in healthcare understands. We've also got to think about how to create these communities and connect people to communities, both the digital ones, but also the physical ones, and what are those connections and how do we help people make them? And then last, but surely not least, I think we need to remember that transformation is truly possible at any age and any stage. And part of our job is to help people maintain hope so that they can, in fact, do that for themselves. So please reach out to me. I'd love to talk and open to any questions. Yes. Yes, hi. Yeah, it's a great question. Um, I think it's going to apply more and more, quite honestly. But we've got a lot of incentives that go crosswise in healthcare. So on the one hand, you've got the high deductible plans that have you taking a certain percentage of the costs and trying to manage that. On the other hand, and what that means is you shop for the cheapest price, um, kind of wherever it is. But exactly, and precisely because they have high deductible plans that make it hard to get even the most basic care. Kelly had another part of his story where one of the things that he went in for a annual physical, free, part of his plan, and his doctor said, "Well, any other issues you want to talk about?" He said, "Well, I'm kind of afraid to raise it because I think you'll charge me more." And his doctor said, "Oh, that won't happen." So he asked his question. Doctor referred him for physical therapy, which he didn't go to, mind you, because it was going to cost him too much. Guess what? Got an extra charge for an office visit rather than a preventive care visit that was free because he'd asked that question. Is that really what we want to have happen? Is that really the method we want to approach? So I think it's a great point that we've got to think through kind of the layered incentives. I also think that if I buy a cheap plan with a high deductible or a narrow network, give me an option so that I can buy, say, a personal reinsurance policy. That if I end up with cancer this year, I could go to Mayo, or I could go to Stanford, or I could go to MD Anderson. Give me some outs so I don't get trapped into this kind of war about, oh my God, I bought a policy that seemed reasonable until I needed to use it. Yes. Right. Alexandra Drain talks about this. She's not here right now, but she's at the conference. As she talks about cost as one of the great unmentionables in healthcare. It's a presence in every conversation about health and treatment. It's in the room between doctors and patients, but it's very rarely talked about. It has a huge impact on whether patients, in fact, follow an agreed upon course of treatment, because when they actually figure out the price, they may not be able to afford it. They may be too embarrassed to ask the questions that Kelly was so brave and so persistent about asking. And they may also feel embarrassed that cost is an issue for them, and they don't want to be perceived as that kind of a person who actually worries about cost. Or it's for a loved one, and they don't want to look at the fact that this makes them think about what's the price of their loved one's life or health. So we, I think, really need to figure out ways to bring it from the unmentionable companion in the room out into the open. It is as much a factor in shared decision making as the actual course of treatment, the efficacy of the treatment, and the values that the patient brings into it. So it's, I think we are at a moment when there's an opportunity to start having those conversations, but we've really got to think about what the infrastructure components that support it are. Anything else, or are you guys ready to almost go to drinks? I'm not chasing them away. Not chasing them away. They're not serving until he's done. Okay.